Susie, my name is Caitlin. I'm going to be your nurse today. Today we're going to do a head and eyes, ears, nose, and throat exam. It'll take roughly about 5 or 6 minutes, and I'll let you know what I'm doing prior to doing it. So I'm just going to provide some privacy and wash my hands. First, what I'm going to do is just look at your face and your head and make sure there's no rashes or irritations in the shape and the symmetry. All looks normal. Next, I'm just going to touch your scalp and put a little bit of pressure to let me know if there's any tenderness. There's no bumps. It looks normal. Next, I'm just going to look at your scalp and check for lice or rashes or everything looks normal. Next, I'm just going to inspect your eyes. Nope, do your jaw. So I'm going to put my hands on your jaw, and could you open slowly and close and open and close. All right, normal, no clicking. Does everything feel okay? All right. Next, I'm going to inspect your eyes. So first, I'm just going to look at the outside for the symmetry and the pupils and everything looks normal. Next, I'm just going to put my fingers underneath your eyelids and I'm going to pull down. If you could just look up for me. Cornea looks nice and white and everything's good. There's no redness or swelling. Next, I'm going to check the reflex, your corneal light reflex, by shining this light. If you could just kind of look at the light. Alright, reflex is good, same place in both eyes. Next, I'm going to have you cover your left eye with this. Just stare at me. Now, if you could uncover. Good, your eyes are both focused and not moving. And I would do that to both of your eyes. And next, I'm going to shine this light to the side of your eye, and I'm going to look at the cornea and make sure it's clear and not cloudy. You can just stare forward. Alright, normal, good. And next, I'm going to take the light and I'm going to bring it forward, and I want you to just focus on the light. I'm going to check your pupil reflex. Make sure your eyes are reacting the same way. Alright, good, normal. Next, I'm going to have you follow the pen. I'm just going to move it from side to side. If you can just follow it with your eyes. Keep your head straight. Go over this way. Up, down, over. Alright, good. Now if you can just still focus on the pen, and I'm going to move it closer to your nose. Just going to check your accommodation. Alright, good. Now I'm going to inspect your ears. First thing I'm going to do is I'm just going to feel the outsides and make sure there's no tenderness, so let me know if anything is tender. Inspect your pinna, your tragus, your mastoid. Alright, now I'm going to take the otoscope and I'm going to look inside your ear, inspect for, the condition of your membrane and any inflammation or pearly and gray, no redness, looks good. And I would do that on both ears as well. Okay. Next, I'm going to test your hearing. And the first thing I'm going to do is I'm going to strike the tuning fork and I'm going to put it in the top of your head. And I'd like you to tell me if you can hear the sound equally in both ears or not. Okay.
I hear it much louder on the right side.
Okay, I can note that. And next I'm going to test the air versus bone conduction. I'm going to strike the tuning fork again and I'm going to put it right behind your ear on the right. And let me know when you stop hearing the noise.
I stopped hearing it.
Okay. Are you able to hear it?
Yes.
Right, normal. Next I'm going to have you plug your left ear, or cover your left ear, and I'm going to whisper a word to your right and let me know, and repeat that word to me. Okay.
Babies.
Good. Alright, next I'm just going to inspect your nose, see if everything's symmetrical and looks normal. Now I'm just going to shine this light inside your nasal cavity, and I'm just going to check the septum, and I'm going to pretend to do that, and everything's good. Next, could you just plug one side of your nostril and sniff. Okay, patency is good. You can do the same with your other side. It's good. And now I'm just going to palpate your sinuses. And it's going to feel kind of like you're going to feel pressure, but let me know if it hurts or it's tenderness besides the pressure. Okay. Into your frontal sinuses. Sinuses. Alright. Next, we're going to inspect your mouth. If I could just have you open your mouth nice and wide. I'm just going to shine the light. Alright, just going to inspect your cheeks, your tongue, your teeth. Could you pull your tongue up underneath? Everything's normal. Could you take your lips and could you fold it up? Alright, thank you. Could you do the same to your bottom? Alright, looks great. Now could you open your mouth up wide and say ah so I can check your gag reflex? Yep, and your soft palate is moving up, normal. Next I'm going to inspect your neck for any swelling, bruising, lumps. I'm just going to shine the light and I'm going to look to the side. You could just look forward. Everything's normal. Alright, now I'm going to palpate your lymph nodes. So first is the pre-auricular, post-auricular, occipital, submandibular, submental. Could you turn your head to the left for me? I'm inspecting the anterior clavicle, cervical, anterior cervical, posterior cervical, and your supraclavicular lymph nodes. Alright, looks normal. And now I'm going to inspect your thyroid. So if you could look up, I'm just going to be touching your thyroid very gently. Could you swallow for me? Alright, everything looks normal. Well, thank you so much, Susie. I will write down the hearing that you had a little bit more hearing on the right, and then I will get back to you. Have a good day.
Thanks.